New parents face an exciting future filled with sharing their child's special discoveries and stages of growth. From the moment many find out they're going to be parents, their main concern is that their baby will be born healthy. Keeping your baby healthy is important too. However, one often overlooked factor in your home can affect your baby's health dramatically. It can put your child at risk for ear and throat infections. Childhood ear infections are the leading cause of hearing loss. Breathing problems, including asthma, pneumonia, even sudden infant death syndrome, SIDS. This health hazard is secondhand smoke. Secondhand smoke is the smoke exhaled from a smoker, or the smoke that comes from a burning cigarette, pipe, or cigar.
Secondhand smoke puts very small particles in the air, which we know contain many dangerous chemicals. In fact, about 4,000 chemicals are in this smoke. Children are not, and infants are not tiny adults. They actually are human beings of their own. They have higher respiratory rates, higher heart rates. Their organs are still developing. So exposure to these 4,000 tiny particles is actually more a risk or more an environmental hazard for these children because they are breathing in these particles at a higher rate, and it is causing harm to their developing bodies.
Secondhand smoke puts a child's future health in jeopardy. It has been associated with a higher risk of learning disabilities and behavioral problems in children. Studies have also linked exposure to secondhand smoke to cancer and heart and lung disease. The Surgeon General's report states that there are no risk-free levels of secondhand smoke. Even exposure to a small amount can be harmful. The only way to protect your child is with a completely smoke-free environment.
Well, when children live at home with secondhand smoke, it's important to remember that there's two kinds of smoke. There's the secondhand smoke, which is dangerous, but it's been filtered by the mom. And there's also a thing called side stream smoke. Side stream smoke is a smoke that actually is in the room that gets on the children's clothes that they breathe into their lungs. That's not filtered at all. And it's more dangerous than secondhand smoke because it contains 2 or 3 times more chemicals.
Many people, including smokers, are not aware of just how dangerous secondhand smoke really is. Exposure to secondhand smoke is especially dangerous to infants and children because they are still developing and growing. When you or your child breathes in secondhand smoke, you're breathing in 4,000 chemicals. According to the American Cancer Society, more than 250 of these chemicals are known to be toxic or cause cancer. Some of the very same toxins we try to keep away from our children are the same toxins they're breathing in with secondhand smoke. Secondhand smoke contains ammonia, which is a poisonous compound used in household cleaners. Arsenic is a deadly poison used in pesticides. Butane is a highly flammable gas used in lighter fluid. Carbon monoxide is a highly toxic gas found in car exhaust. Lead, which is a cancer-causing toxin used in batteries and some paints. Hydrogen cyanide is a chemical used in making insecticides and chemical weapons. Benzene is a chemical known to cause leukemia. It's found in inks, rubber, paint remover, and gasoline. And formaldehyde, which is a cancer-causing chemical that is used in fertilizers, disinfectants, and embalming fluid. The Environmental Protection Agency lists secondhand smoke as a Class A carcinogen, which falls in the same category as asbestos. That means they are known to cause cancer. These are only a few of the dangerous chemicals and gases found in secondhand smoke. It's no wonder that every year secondhand smoke causes serious health problems and even death in our country. According to the Environmental Protection Agency, it's estimated that between 150,000 and 300,000 lower respiratory tract infections in infants and young children are caused by secondhand smoke, which result in almost 15,000 hospitalizations every year.
Babies that are exposed to the mother smoking, they are what's called passive smokers, putting them at greater risk for SIDS, ear infections, eye infections, bronchitis, pneumonia, cough, croup, Their immune system isn't the strongest, so they're a higher risk for infections.
Secondhand smoke is a serious poison. It causes about 3,000 non-smokers to die from lung cancer every year. It's also estimated to cause approximately 35,000 deaths from heart disease. According to the U.S. Surgeon General's report, a 100% smoke-free environment is the only way to protect you and your loved ones from secondhand smoke. Here are some tips on how to protect your child from secondhand smoke. Don't allow smoking in your home. If telling visiting family and friends not to smoke is awkward for you, place a no smoking sign on your door or inside your home. Disposing of ashtrays may also discourage visiting smokers from smoking in your home. Don't allow smoking in your vehicle. If you're traveling with a smoker, simply stop somewhere so that the smoker can smoke outside of your vehicle. Go to restaurants that are smoke-free. If a restaurant has a smoking section, it is not a smoke-free environment. Fans and ventilation systems do not protect you and your baby from secondhand smoke. If your child goes to some type of daycare, make sure it is a smoke-free environment. All licensed daycare facilities in West Virginia are required to be smoke-free. If you smoke, quit. If a spouse or other family member smokes, encourage them to quit too. Not just for you and your baby, but also for their own health. Offering your support and patience to a smoker trying to quit can be very helpful. It is important that you keep a smoke-free environment for your baby and others. The West Virginia Tobacco Quit Line can be extremely helpful and effective for anyone who wants to quit. The West Virginia Tobacco Quit Line offers a free or low-cost program to smokers who want to quit, free educational materials about how to stop smoking, 4 free calls with a phone coach to assist the smoker in quitting, and nicotine replacement therapy is available.
We become a family with the people we're dealing with. We give them a total support system that they can rely on, trust on, and help them to get through this very difficult type situation. That's one of the biggest fears that people run into, is they don't really understand what the process is for quitting, and there is a process. After developing a rapport with these folks, then you can decide what would work best with them in their situation, tailoring their needs.
Learn skills and techniques that can help you through the quitting process, and get the support you need to quit for good. The benefits of quitting last a lifetime for you and your baby. Children who grow up in non-smoking homes are even less likely to become smokers themselves. You want the very best for your child's future, so protect your baby's health and yourself from the dangers of secondhand smoke. Call the West Virginia Tobacco Quit Line today.